Yo, what is up, guys? Today I'm going to be demonstrating a med pass. I'm Westin. I'm a UT nursing student. Here's my badge. I'm going to do a little 360 room scan. Alright, so first I'm going to walk into the med room. I'm going to review orders, which is going to be allergies, time of administration, and the date as well. Time of administration is 11 o'clock, and then 11 o'clock a.m. And then allergies are sulfa, and then today's date is July 16, 2021. And then I'm gonna do a review nursing applications such as blood pressure, pulse ox, labs, stuff like that, just to make sure when I get the medication at the time being that it is safe to do so. And then after that, what I'm gonna do is if the medication needs to be taken with food or without food, I will, well, given the medication today, which is furosemide, it is recommended that it be taken with food, but it can also be taken without food. So I'm just gonna bring in food just in case the patient wants to take it with food. And then now what I'm going to do is I'm going to review the 6 rights of medication administration. So the first one is going to be checking the right patient. So what I'm going to do is I'm going to go to Acudose and the EMR, making sure his name, so Michael Head, and then I'm going to check the EMR number, or the MRN number. Sorry about that. Okay, those are the same. And then the date of birth, also the same on the 2. Next, I'm going to be looking at the medication. So the medication I'm going to be administering today is furosemide, 80 milligrams. So there's a furosemide 40 milligram tab on Acudose, and on EMR it says to give 80, so I'm going to give 2 tablets. And then after that, I'm going to review the dose. So I just said the dose. So the dose is 80 milligrams, and then on here it says Acudose says 40 milligrams. So again, 2 pills. And then I'm gonna look at the route. The route was oral, so the orders say oral, and Acudose says a tablet, and tablets can be taken orally. And then after that is going to be the time, which is at 11 o'clock. Verify. All right, and then I'm going to document my findings later on. Now what I'm going to do is I'm going to dispense the medication. I am going to make sure the packages are intact, and I'm going to check the milligrams here. It's 40 milligrams. Expiration date is 12 of 22, so December 2022, so it's not expired, and it's furosemide 40 milligrams, and we have 2 of them, which equals 80, so we are good there. So now I'm going to log out of EMR and Acudose just for HIPAA purposes. Wouldn't want to get hacked. And then I am going to gather my supplies, which are over here. Right. All right, so now that I have my supplies gathered, I'm gonna adjust this real quick. Now that I have my supplies gathered, all right. All right. Now that I have my supplies gathered, I am going to go to the patient's correct bedside. So right here at my patient, let's see if you can see this. All right. All right, so correct bedside. So I'm gonna walk in the room, wash my hands, introduce myself, 2 patient identifiers, so name, date of birth, explain the procedure. So today we're gonna be helping control your blood pressure and your edema. Your blood pressure is high and you have some swelling. So we have these medications. I'm going to describe next what the medications do. These medications are going to help bring the swelling down and also lower the blood pressure. So now what I'm going to do, we're going to come back over here. We are going to log right back into EMR. All right, so I have EMR open. So now that EMR is open, I am going to, let's see, EMR is open. I'm going to scan the patient's wristband. So as you can see right here, I'm going to scan the wristband. And I'm going to check for allergies. And allergies, yep, sulfa. So we scan that. And then we're going to come back over here. We're logging into the EMR. Yep, so we're on the EMR. Scan for allergies, double checked sulfa. And now what we're going to do is we're going to scan the medication. So we're going to scan both of them since there's 240 milligrams and he needs 80. So boom, boom. And then both of those are scanned. And then before I can give it to him, I had to scan his wristband. So I just scanned his wristband. So now that that's done, after I scanned everything, next I do is I explain 6 patient rights again. So I'm gonna make sure that on the wristband, the date of birth and MRN number, I don't know if you can see this. Yeah, the date of birth, MRN number, and the name match up, and they do. And then I'm gonna look at the medications. So furosemide, I have the medications right here, furosemide. So they do indeed match up. And then expiration date and everything. And then next, we'll look at the dosages. So 240s and he gets 80, and administered is to be 40. So that's right. And then the route is oral, and I have tabs. And then the order says for oral, so the order says oral, and AccuDose says tablet, and tablets are distributed or given orally. And then the time, so it's 11 o'clock, so it's just in time to administer. So now what I'm going to do, I wash my hands and put gloves on if possible, and then for this demonstration, I'm going to put the patient upright, give the patient the medications, and then as I give the medication, I'm gonna watch them swallow the medication, and then after that, I'm gonna document anything they did not take, because anything that's not documented is not there and they did not take it. And then after that, I'm going to double check the time and the documentation of the medication, giving the medication, just to make sure that I had the correct time. And after that, I'm gonna log out, and then I'm done.